Brushing your teeth is something that everybody does, I think. Anyway, despite that, everybody still seems to have their own idea on how to do it. So I thought I'd clear the air and do a video on which brush to use, how to do it, and then as well some variations. Now I first want to address which brush to use. I'll do another detailed video on this, but manual versus electric. Well, the research actually shows that it doesn't matter which one you use as long as you're brushing effectively. Now the other thing to consider is the head of the brush. The first thing is that you want it to be really simple. Don't buy into the gimmicks of the heads that are kind of going in weird directions and bits of plastic. You don't need that. You just need a simple head. And in fact, if you get a smaller one, like from a children's toothbrush, that's actually even easier to use because you can manipulate it into different positions in the mouth. For an electric brush, the exact same thing. The simple heads work the best. Lastly, make sure it's a soft-headed toothbrush, or an ultra-soft. The medium and the hard ones, although they feel like they're doing more, they can actually cause gum recession and abrasion and wear on your tooth itself. Now the soft is actually equally as effective as long as you're using it properly. And before we talk about the technique, I first want you to understand the goal. Now I'm going to use this image here to help explain it.
I just want to pause the video just so I can explain this image first, and to do that I'm going to use an actual photo from a patient of mine. Basically you have the gum sitting over the top of the tooth, and in the cartoon version how that is represented is you have the gum on the outside, then on the inside you have the tooth and the tooth root, which is actually sitting inside the bone. Okay, we'll continue.
So where the tooth actually meets the gum, there's a slight gap, and this gap we call a pocket. Now inside this pocket there's food, there's plaque, and there's bacteria. Now when there's food and plaque there, the bacteria actually break it down, turn it into harmful chemicals that are responsible for gum disease. Therefore, when we're brushing our teeth, what we want to try and do is remove that food and that plaque so the bacteria can't produce those chemicals, as well as any other food that might be in your mouth at the time. So what that means is that when we're brushing, the fibers of the brush actually have to go down into this pocket. Now to do that, instead of going straight at the tooth, you want to be angling the toothbrush down so the fibers actually go into the pocket. Now a lot of my patients, what they often do is they go back and forth because it's the easiest way of doing it. However, I might advise that you don't do that because, hey, just a thought while you're watching. If you're getting something out of the video, hit the like button or hit the subscribe button. It really helps me out a lot. Because it can be quite aggressive to the tooth and or the gums. So instead of that, gentle circles are best, making sure that you are angling that toothbrush. Now in saying that, if back and forth is easier for you, then I would rather that you use a soft toothbrush and go back and forth and be more effective than doing gentle circles and doing it incorrectly. For an electric toothbrush, it's the same idea, except you don't need to move it back and forth. So bring it to the tooth at 45 degrees and then move it along very slowly and let the vibrations do the work. So doing this systematically helps to make sure that you don't miss any bits. So what I tend to do is I'll start on the bottom right hand side, angling the brush, going all the way around. Then we're going to do the tops of the teeth. And then with the inside, you're going to do the same thing, angling the brush at 45 degrees. Back and forth or gentle circles, up and down for the insides of these, angling that toothbrush again. For the top teeth, it's the same, except you're going to be angling up towards the gum. This entire brush should take you about 2 or 3 minutes. For an electric toothbrush, what I tend to do is divide the mouth into quarters. So quarter 1, 2, 3, and 4. And I do 30 seconds for each, brings me to 2 minutes. Now for those that already have recession in some areas, or you might have some veneers or crowns at the front that you're worried about recession, you might want to steer clear of doing the back and forth or the circles. And instead, the most gentle way you can do this is by flicking down the tooth. Again, you want to be at 45 degrees, and then flick like this. Flick, 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 up at 45 degrees, flick, flick, flick. You do about 5 per tooth, then move to the next one. Now, it is the most difficult way of brushing, but if you stick with it, you should get good at it. If you can't and you're just not being very effective, I prefer that you do gentle circles with a very soft brush and do it effectively rather than do it the other way, not effectively. Okay, to summarize. Number 1, the type of brush to use. Manual or electric, it doesn't matter, as long as you're brushing effectively. Making sure it's a soft-headed toothbrush or ultra soft, and make sure it's only a simple head, you don't need the complicated ones. And the smaller, the better because you can reach in different areas. Number 2, making sure the brush is at 45 degrees, so you're brushing the tooth and the gum at the same time and inside that pocket to get the plaque and the food out. Number 3, gentle circles. If you can't do gentle circles, back and forth is okay as long as it's a very soft toothbrush. Number 4, do it in a systematic way, going all around the mouth, taking about 2 or 3 minutes. Number 5, for those that already have some recession or you have veneers or crowns on front teeth, angling the toothbrush at 45 degrees and just flicking down. As always, thanks so much for watching. If you got anything out of the video, like and subscribe. It really helps me out a lot. If there's anyone that you can think of that might benefit from it, please share it with them. If you have questions or comments, put them in the comments section or you can send me an email. And remember, keep on smiling.